We're going to start off hot this morning. Start off with story number one, where thousands of federal health agency workers were laid off by a letter happening over the weekend. So, this past weekend, as the firings continue, about 3,600 probationary employees from the Department of Health and Human Services, which was just had its new leader selected or confirmed by the Congress, were laid off. These layoffs affected staff across basically all agencies, various places, including the CDC, FDA, and CMS. So various things under Health and Human Services all lost people, which is why the number is so high. Noticeably, the CDC saw about 1,300 employees dismissed, while the National Institute of Health, NIH, had about 1,165 staff members laid off. These were people that, of course, part of a broader initiative to reduce the federal workforce. Over 9,500 employees dismissed across multiple departments so far, and more to come because ones who didn't take the payoffs or the buyouts or what do you want to call them are still being fired anyway. And some of those, the actual payoffs or buyouts, whatever, still a little sketchy. Now, the layoffs have raised significant concerns over potential weakening of public health programs. Experts warn that reducing staff in critical areas could impair the nation's ability to respond to health threats, such as the ongoing H5N1 avian influenza outbreak. The USDA's National Animal Health Laboratory Network, essential for coordinating responses for such outbreaks, experienced a 25% reduction in staff for the weekend, which may hinder effective management of the crisis. Officials from the Trump administration assert that these layoffs were strategically planned to protect the core functions with health agencies. They emphasize that critical roles, including CDC and FDA scientists, frontline healthcare workers, and Medicare employees, were spared to maintain essential services. Administration aims to cut costs and reduce the bureaucracy, projecting annual savings of $600 million from HHS alone to offset the trillions of dollars they eventually want to find across the government. Now, despite the assurances from the administration, lawmakers and health experts are criticizing the mass firings. They argue that the abrupt reductions could disrupt vital services and demoralize the remaining workforce. The process has been described as chaotic and indiscriminate, with reports of essential roles being affected. Additionally, the layoffs have led to feelings of betrayal among federal employees, especially those dismissed just before completing their probationary periods, which would have granted them higher job protections. These layoffs are part of a wider effort, as we said, by the Trump administration, to reduce the size of the federal government. And in total, over 9,500 federal employees have been dismissed so far, primarily targeting those on probationary periods, the ones without protections that you can cut easily. They are over various departments: energy, interior, veterans affairs, agriculture. Basically, they run the gamut. Critics are contending that these measures prioritize cost cutting over effective delivery of essential public services and would jeopardize the nation's health and safety. Now, as we said pretty staunchly, the main target, the easy target, the front target are people on probationary statuses, people who can be fired, without cause because they're on probation. They don't reach that status, so they don't have protections. However, the numbers of people that they're dismissing right now don't actually reach up to the numbers that leave on attrition anyway. These are essentially people who would be coming in to fill the gaps for people already leaving. And what it looks like for people who are actually taking out the buyouts were folks who were already leaving anyway. So no actual extra cuts are being done. We're just cutting away from the new blood coming in as opposed to cutting away actual waste, fraud, abuse.